Trade TV Health Lesson with Theophilus and Michael. Our topic of discussion today is diabetes, which is popularly known as the sugar disease. And at the end of this lesson, we are going to know what diabetes is, the types of diabetes, the causes of diabetes, the signs and symptoms, and the treatment and prevention. Now, according to the World Health Organization, it is known that 1.6 million people died out of diabetes in 2016. And it is also estimated that 425 million people are currently living with diabetes all over the world. And by 2045 projection, it is estimated that 629 million people are going to be still having diabetes globally. Now, I will leave it to Mike to give us what diabetes is.
So now, what is diabetes? Diabetes is not just one disease, but it is a heterogeneous group of polygenic syndromes characterized by elevation in fasting blood sugar level, or glucose. Now, diabetes is one of the leading causes of adult amputation, hypertension, etc. Now, for our lesson today, diabetes is grouped into two major types: diabetes insipidus and diabetes mellitus. Now, diabetes mellitus is also further grouped into two: diabetes type 1 and type 2. Now, the type 1 is also called insulin-dependent diabetes and juvenile diabetes. In the sense that its noticeable peaks falls within the ages between 4 and 7 and 10 and 14. Now, diabetes, as the name depicts, insulin-dependent. That means there is no insulin production or very little production of insulin by the beta cells of the pancreas. Now, what does the insulin do? Insulin is a polypeptide hormone. It's a protein which works as a hormone, or it's a hormone that works. it's a protein that works like a hormone to mediate the metabolic pathway to break down the glucose that we gain from the carbohydrate that we gain from food into glucose that will be metabolized into the various cellular energy for the energy of an individual. Now, insulin supplements are given to patients living with diabetes type 1, diabetes mellitus type 1, for management. And it comes in with a lot or with several forms. We have the rapid, which begins from 15 minutes to 3 to 4 hours. And we have the short, which begins from 30 minutes and lasts for 6 to 8 hours. And we have the intermediate that begins with 1 to 2 hours and lasts for 6 to 8 hours. And we have the long one that begins from several hours to 24 hours.
Okay, then we have the type 2. The type 2 is also characterized as the insulin resistance. Now, in this type 2, as explained earlier in the type 1, there is also the dependency on the hormone insulin. Now, the liver cells or the muscles and the fat cells are not properly using the insulin that is in the system. So for some time, the beta cells or the pancreas is able to produce insulin and is being utilized by these liver cells that I've mentioned. But it will get to a point where the beta cells of this pancreas does no more produce the hormone insulin that will break the glucose, as he has explained, to produce energy. So initially, the production of the insulin is able to utilize the energy that comes into the system in order for the bodies and the tissues to be supplied in order to continue the normal life processes. So when this production of insulin is shattered, now any energy or carbohydrate that comes into the blood is being compounded. Hence, there's no more breakdown to release energy. And this case often happens in the obese people or people who are physically inactive. So when you are not active, the insulin, when you are not physically active, there is always compoundment of the energy, the glucose or the sugar in your system, because it's not being broken down to supply energy into your systems. Now let's come to the symptoms or the signs of diabetes. What is characterized by the patient who is having a diabetes, or what I mean is the signs that will show that this patient is having diabetes. Now, to start with, I'll make these two points. There is always increase in thirst and frequent urination. Now, when a patient is having, or a diabetic patient is diagnosed of diabetes, there is increase in thirst because already the system is already concentrated with high level of sugar in the blood. And from our basic science, osmosis, we know that anywhere there is high concentration of sugar, there has to be, solute, there has to be a solvent or water that has to move to that side in order to maintain balance. So when your system is concentrated with high level of sugar in your blood, your system therefore calls for water in order to maintain this balance within your blood, so as to end the high level of sugar in your blood. So there is increase in thirst of that patient. And when the patient takes in more water, there is also going to be frequent urination, because there is the organ kidney, which is going to function to remove excess sugar that is in your system. And this sugar cannot be excreted out in the form of the sugar that we see. So it has to come out in a fluid medium. That is what we get urine. So there are some urine that is when there's a test undertaken through the urine, you see some glucose, which is also as a function of the work of the kidneys. So there is also frequent urination from a diabetic patient, because the kidney is functioning to bring out excess sugar in a fluid medium. And also a diabetic patient is noted for increase in hunger. He easily gets hungry, because the normal pathway that your body has to go through to produce energy, it is being halted. So the body then depends on the fat cells or the fat that is in your body in order to produce energy. So when this fat is being utilized, then the body therefore calls for replacement of that fat. So a diabetic patient, although the person is having some breakdown of the fat, yet still he needs some amount of energy or a food that will replace the energy that has been used already in the system. So there is also increase in hunger in a diabetic patient. And we also have fatigue. Diabetic patients are always tired when they engage in any physical activity. Within some few time, they easily get worn out. It is because the energy or the sugar in their system is not being broken down to produce energy. So there is insufficient energy in their system. So when they engage in any aerobic or any other activity, they easily get tired. And there's also slow healing of wound when they get an infection. And there is also blurred vision. A diabetic patient does not see clearly because there's no optimum production of energy to the eyes. So because the eyes need some energy in order to accommodate and visualize certain things. Yeah, so now, since we know the signs of diabetes, now it is better that we get to know how we will prevent it at all, not to get it before we start treating it. But it is better for us to prevent it straightforward. Now, what should we do in order to prevent diabetes? Now, we have to engage in aerobic exercises at least for like 150 minutes every day. If I say aerobic exercise, what I'm trying to say is walking, cycling, trotting, jogging, those daily exercises. It also helps us in diabetic check. And also patients, or not even patients per se, individuals should take in more fruits and vegetables. And also carbohydrate, refined carbohydrates and fat food should be abstained by individuals. And you also have to, and obese people, the fat people, should also try to engage in exercises that will reduce their weight in order not to, for them to be found wanting in the type 2 diabetes, as you have explained. Yeah, and finally, you have to do medical checkup to know the level of your sugar in the system, so that you can know how to take in some measure of food. This can be done by going to the hospital to confirm some results from your clinician or the doctor.
Now, to crown it all, alcohol too serves as a major factor of destroying insulin beta cells, the beta cells of the pancreas that brings about the insulin production.
Okay, so thank you very much. This is the brief information about diabetes. So we'll admonish you to subscribe to this channel so that you'll be getting updates about your health, which is very, very important. Welcome once again to Trade TV. Bye-bye.